What's going on, everybody? Dr. Scott Simon here, Oak Creek Relief and Wellness. Some of you may have heard about this, some of you maybe not, but we're gonna rant a little bit right here, so just warning you, so get ready. The American Heart Association, American College of Cardiologists just came out with new guidelines as to what they deem to be high blood pressure. So it used to be 140 was the high number, you know, it's always two numbers, like 140 over 85, 130. So now it's anything under 130 over 80 is the number that they're determining. It used to be 140. So what does this do? This puts about 50% of the country into the category of you have hypertension or you have high blood pressure. Now, this is where it kind of gets different. Why are they doing this? Yeah, we could talk about why they're doing it, sure. But just to preface this or just kind of talk about for a second, high blood pressure can be a serious issue, yes, if it gets really high. But most people are in that mid-range where they're slightly high and they don't need to be on a medication. Of course not. Lifestyle will change everything. Most of the time, if you get your blood pressure taken and you're high, nobody ever asks the question, why? Why is it high? So like, is it insulin related? If you have hyperinsulinemia caused by high blood sugars, which is gonna spike insulin, it's gonna affect your sodium retention. It's gonna also affect sodium and potassium distribution, which is gonna also increase peripheral vascular resistance. It's gonna affect your blood pressure. What if you're stressed out with work, stressed out with family? When you're in that fight or flight mode, the very stressed out mode, you're going to be pushed into more of that sympathetic dominant, sympathetic division of your nervous system, which is more fight or flight, go, go, go. It's going to naturally raise your blood pressure. Nobody asks these questions. The other thing is, what if you are dealing with lack of exercise, lack of physical activity, where you're not perfusing enough blood through your tissues, so your tissues are starving for oxygen and nourishment, and your body is naturally raising your blood pressure to try to pump more blood through there. Our bodies aren't dumb. There's always a reason. So if you just got on a treadmill and ran a little bit and got off the treadmill and went to your doc, your medical doc, let's just say, and they take your blood pressure, oh, your blood pressure's high. Now, of course, they're gonna know that, wow, you were just exercising. You were just on the treadmill. That's why your blood pressure was raised. But what if somebody is on the treadmill of life, so to speak? What if something is causing that blood pressure to go up? Rather than just throw a pill at you right away, that's what we do. We ask the questions. We address things like diet, lifestyle factors. Are you being physically active? Are there other things in your life that are raising your blood pressure that can be addressed as well? So before you start getting scared thinking, oh my gosh, they just told me now I have hypertension, I have high blood pressure, I need to get on a medication, ask the right questions, visit a healthcare provider, find a practitioner that actually will work with you to reduce this so you don't have to go on a medication. Because I would venture a guess to say that 99% of the time with these high blood pressure medications, maybe not 99, 90% of the time, they're not necessary. Everything can be adjusted or helped with lifestyle modifications. That's the tip for the day. Rant over. Thank you very much for your time, everybody. Have a great rest of the day.